GBC Health, in terms of history, is the Global Business Coalition on Health. And this was the global coalition of corporate bodies that came together to fight HIV/AIDS. Our founding CEO at the time was Ambassador Holbrook. Having really done great work for HIV/AIDS and related illnesses across the globe, particularly in Africa that bears the brunt of the disease, the board of GBC Health teamed up with the Dangote Foundation to birth ABCHealth. So we take the institutional memory and capacity track record of GBC Health, apply that model to Africa.
You talked about the model of GBC Health and you working to apply that in Africa. Can you kind of explain to us that model?
Health is indeed wealth. There is such an absolute correlation between the health of the citizens of a nation and their wealth. GBC Health had toolkits, had means of going to teach large corporations with huge employees safe living practices, healthy practices, and then also you have some social issues around every pandemic, even as we find here, stigmatization, etc., etc., etc. And then the mental health, mental trauma counseling, and all that. So these are the things that GBC Health at the time did. Focused, of course, on HIV/AIDS. There's no sense in reinventing the wheel. So if one corporate has a good practice, okay, it was a platform where you could share knowledge, share ideas, and so on. So that, in essence, was what and how GBC Health, operated.
So when you look at the impact of COVID-19, what is the takeaway for you from a philanthropic perspective as an investor in health?
The beginnings of 2019, I began to advocate more and more around the fact that if we don't fix Africa's weak health system, if we don't fix these foundational issues, we will continue to have this perennial problem whereby when there is a major health issue around the world will rally, deal with that issue, but Africa will continue to bear the brunt of that issue whilst the rest of the world has put it to bed. Malaria, HIV, and so on. And then along comes, COVID. What you see with COVID is you are seeing a repeat of that. We know that the answer is the vaccine. And when you think about vaccine inequity in terms of who has access to vaccines, and then the ability again to mobilize the people to overcome vaccine hesitancy, Africa is lagging behind. In some African countries, you don't even have something that rounds up to 1% in terms of the amount of population that has access and has been vaccinated. How are we going to deal with this if we don't cooperate as Africans? How are we going to deal with this if we don't mobilize help, from outside? So again, this notion of coalitions, particularly the private sector, because African governments are much weaker than their global counterparts. So we've really got to rally the corporate world, rally multilaterals and philanthropists, okay, both African and from outside Africa, to focus their minds on this issue.
There is an event happening, the Africa Investment Summit for Health. How do you think this particular summit will shift things on the ground?
Well, the first is that there are not many summits on investment that focus on health. So it's fresh, it's an unexplored space. So I think that in itself, from investor standpoint, is very unique. There are three factors that must come together. One is the will of government. The second is the active involvement and investment of businesses. And the third is finance. So we've got to put these three stakeholders in one room and ask them this big question. In Africa, you have 1.3 billion people. Their biggest spend is actually on health. But why is it that the manufacturing of medicine, medical equipment, and other ancillary things in the medical value chain, the health value chain, is almost not absent in Africa? And as a result of that, from a strategic standpoint, for example, with COVID, our ability to respond to health issues is very much hampered. So this must be reversed. That's what the summit is all about. Bringing government into the room, bringing business into the room, and bringing finance into the room to begin to finance health in Africa.